Thank you, Mr. President. I thank my friend from Hawaii for convening us here tonight. So this isn't theoretical. This isn't about numbers. This is about real people. We know them. They exist throughout our states. I've told this story a few times on the floor of the Senate before. When I think about the progress that's been made over the course of the last 6 years, I think about Betty Berger. Betty is a woman who lives in Meriden, Connecticut, and Betty and her husband did everything that we asked them to do. They were morally upstanding citizens, contributed to their community. They had full employment. They were raising good kids. And her husband switched jobs. He switched jobs, and he had a 1 week, maybe it was a 2 week period of time in between those two jobs. And as luck or lack of it would have it, during that brief intermission between employment, their son was diagnosed with cancer. That cancer then became a pre-existing condition, which meant that her husband's new employer would not cover the son as part of a family plan. The cancer progressed and progressed and progressed, and this family, the Bergers, had no means to keep up with the payments. And their story, unfortunately, is not foreign to folks who have heard from constituents who have gone bankrupt because of health care costs. The Bergers lost everything. The Bergers first went through their savings, then they went into their son's college account, then they sold their car, then they sold their house. They lost everything they had trying to make sure that they had health care for their son simply because he got diagnosed with cancer during the one tiny interim between their family's insurance coverage. That pre-existing condition doomed that family. And but by the grace of God, would that be us? That could happen to any one of us. And yet today, medical bankruptcy is frankly a thing of the past. Why? Well, it's not because healthcare costs any less. It's because we've said that we are not going to allow insurance companies to deny coverage to someone because they have a cancer diagnosis. In fact, we're not going to allow insurance companies to charge you more just because you are sick. And guess what? People have been able to keep their college savings account. They've been able to keep their car. They've been able to keep their house, even if they get sick. That's what this bill has meant. 20 million more people are insured, yes, but the number of personal bankruptcies in this country have plummeted by 50%, almost entirely because there aren't Bergers any longer. There aren't people who had to live through what the Berger family had to live through. That's what this is about. This is about real people who are going to go through miserable, terrible experiences because of the bill that the Senate Republicans are just days away from putting on to the floor. I know my colleagues have covered this exhaustively, but I just want to show you visually what CBO says the House bill does. I know it's in vogue for the president and Republicans to say that Obamacare is in a death spiral, but that's not what CBO says. CBO says that if you keep the Affordable Health Care Act and you actually implement it rather than undermine it, rather than sabotage it, as the president of the United States is today, well, then the number of people that don't have health insurance, it remains fairly stable from 2017 to 2026. It's about 28 million people. But if you enact the American Health Care Act, the bill that passed through the House, that number goes almost immediately from about 26 million up to 40 million, right? About 15 million people lose insurance right off the bat, like within a heartbeat of passing this bill. About 14 million people lose insurance, and then over time it grows to 51 million people. That is not the Affordable Health Care Act in a death spiral, right? That's market stability. This is a death spiral. The death spiral starts upon passage of the act that is being secretly negotiated today. And I get it that 23 million is kind of a hard number to get your head wrapped around, right? What does 23 million people really really mean. These numbers are so huge. So here's what 23 million people is. It's the entire population of Alaska, Delaware, Hawaii, Idaho, Kansas, Maine, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Rhode Island, South Dakota, and let's just throw in West Virginia. That's what 23 million people is. That is a humanitarian catastrophe, right? And remember, 23 million people is what you get to at the end of 10 years, but 14 million people lose it right off the bat. There is no way for our healthcare system to provide coverage to 14 million people who had insurance one day and then don't have it the next. And by the way, they tend to be the sickest people because that's who's going to lose healthcare first. And so why are we doing this? Right? Why would you choose to inflict this kind of pain on people? Why would you ask to run for Congress in order to put this kind of hurt on the American public? And here's the answer. And I wish this weren't the answer. Like, I wish there was a different answer, but here's the answer. 23 million people lose health insurance, and the cost of that is about $800 billion of money out of the healthcare system. And it's not coincidence that that then gets transferred into $650 or so odd billion in tax breaks for the pharmaceutical companies, the insurance companies, and for really, really rich people. Like that's not just by accident that it worked out that the amount of money that you took from poor people and from middle-class people and from sick people is the exact amount of money that you're transferring to the pharmaceutical industry, the insurance industry, and rich people. And here's another way of looking at it. Here's where the tax cuts go. The lowest quintile, the second quintile, the middle quintile, even the fourth quintile don't get a lot of money out of this tax break. It's the top quintile, it's the top 20% of income earners that get an average tax cut of $2,700. And here's the big benefit. The top 1% of income earners get a $37,000 tax cut out of this bill. The top 1% of income earners get a $37,000 tax cut from this bill. Let me say that again. 23 million people lose health care, so that the top 1% of income earners get a $37,000 tax cut. Who runs for Congress to do that? Right? What constituency is asking for the United States Congress to pass a bill that takes health insurance from all sorts of working Americans, people that are playing by the rules, people like the Burgers, in order to pass a tax cut for the super wealthy? Now, I don't know what's happening behind these closed doors. I mean, I don't know exactly what they're talking about, but I'm going to guarantee you that it's not fundamentally different than what the House bill did, which is what I'm describing here. It is still massive numbers of people losing health care, rich people getting a tax cut, and lots of folks getting hurt. Why? Just because Republicans made a political promise to do this. And I know I have other colleagues who want to talk, so let me just turn for a moment to this process, because the process does matter. The majority is breaking the Senate. They are breaking the Senate. And don't think this won't be how this works if you're in the minority. I mean, the fact of the matter is that we acknowledge that there is a lot that is still very wrong with the American healthcare system. Our constituents command us to try to make those things better. And we would love nothing more than to sit down with the Republicans and try to figure out how we can come together on a path forward to make this healthcare system better. And I know you don't believe us, but you didn't even try. I'm not sure that we believed you at the beginning of 2009 when you said we want to help people get insurance, because we had watched Republicans have control of the presidency and the House and the Senate for a long time without a lot of progress being made. But Democrats tried. Democrats spent a whole year sitting down with the Republicans trying to figure out if there was common ground, holding committee processes, exhaustive hearings. We had 30 days of Senate debate here on the floor. And I get it. In the end, Republicans didn't support that package. And I get it that Republicans can lay blame at the feet of Democrats for not crafting something that could win Republican support. I understand how that argument works. But the fact is that when Democrats were in the majority, they tried. they opened up the committee process. They let everybody in the public see the debate we were having. Why? Because it's a big deal. We're talking about 1/6 to 1/5 of the American economy. If you're talking about reordering that big a segment of the U.S. economy, if you're talking about millions of people benefiting or losing, that shouldn't happen behind closed doors. My constituents, even though they are represented by Democrats, have no less rights than the citizens of Iowa or the citizens of Texas who are represented by Republicans. Why are my constituents not allowed to see the details of what's about to happen to their lives? Why are only a select group of Americans able to have a voice inside that room? Why are the people of Connecticut going to get like 3 minutes to look at this bill once it hits the Senate floor? My constituents are Americans just like the constituents in Republican states are Americans. They deserve to know what's about to happen to them. You're breaking the Senate. And it won't get put back together that easily. These are tough questions. They're partisan questions, but it doesn't mean that there's not an obligation to try to find common ground. And if you can't find common ground, don't bury the proceedings behind closed doors where nobody can see it. People hate this bill. They hate this bill. And they hate it in part because they don't trust the process. When they see this balance, tax breaks for pharma, insurance, and rich people, and them losing coverage, they want to know why they lose and why super rich people win, but they can't get answers because it's all happening behind closed doors. It's not too late. I'll just end with this. Senator Schatz said it right. It's not too late. My Republican colleagues can reject this. Say, let's start over. Let's sit down and see if there are some Democrats who want to work on stabilizing these exchanges, seeing if there's some middle ground, being able to build a bipartisan consensus when it comes to the future of the healthcare system. It's not too late. And I think you're going to hear that consistently from my colleagues this evening. I yield the floor.